Hi. Let's see. I don't know what happened there. The connection just abruptly stopped. Let's see.
Hey, I don't know what happened there, but I just moved to a different spot in my house just in case it's my connection. But anyway, we'll continue from where we
Yeah,
were
so
we were talking. We're
yeah,
talking
there
about
there are a
the
couple different
criteria for the
sort of
diagnosis of PCOS.
societies. There's the Rotterdam criteria, but there's also the Androgen Excess Society criteria. But basically, if you put them all together, essentially you need two out of the three. So you need irregular periods, so outside of the normal cycle length. So 21 to 35 is considered normal cycle length. And you need evidence of male hormone excess. So it could be blood work that's elevated or signs of male hormones that are too elevated. So hirsutism signs like having, acne and hair growth in places that you typically wouldn't see it in females. And then you can see sort of cystic appearing ovaries on ultrasound, but it's not required for diagnosis. And so that's why it's two out of the three for most of these, diagnosis criteria.
Great. So I think that's, first of all, such an important point that it's not just a GYN condition, but I think it sort of becomes that way because of the irregular periods, and then people are immediately like, "Oh, okay, go see your GYN," and then we're ending up kind of diagnosing it and looking into it. But we'll talk about it a little bit later. But yeah, as you said, it really affects a lot of organ systems, a lot of different aspects, and it's something that I think most women don't think about. They're like, "Oh, okay, irregular periods." Okay, oh, somebody told me in my ultrasound that I have these cysts, which, as you said, is not required for the diagnosis. And then that's sort of how they end up with finding out that they have PCOS. So if a young woman is, diagnosed with PCOS, what can she do about it in terms of treatment?
Yeah, so the way that I
How
counsel
can
someone now as an
somebody?
integrative doctor is very different than the way I did it in a clinical practice and a traditional setting. What I used to do in a traditional setting, like most OBGYNs, is say, hey, are you trying to have a baby or not? If you're not trying to have a baby, then I would have offered you birth control pills, and I would have also maybe offered you, spironolactone or metformin if you have insulin issues or acne issues. But now the way I do it differently as an integrated medicine doctor is I really try to find out, A, what is someone's goals? Like what's going on? What are your symptoms? Because if you look up PCOS symptoms, it's pages and pages and pages of stuff. It's not just the obvious GYN stuff like irregular periods and
Yes,
acne and mood,
yes.
and it can be bloating. It can be dental disease. It can be poor healing. You can have migraines. Like it can be bladder issues. Like it's a whole array of symptoms. So a lot of times my first step is always saying, what is going on? What do you want relief from? Right? Like for me, it may be hair loss, but for somebody else, they might want to lose weight, or somebody else that might be, I'm tired of being exhausted all day and I can't even play with my kids because I'm wiped out. So what are the goals? Second, we need to really look at it as a metabolic problem. So with my patients, I look at their metabolic profile. So I look at their fasting insulin and fasting glucose. I look at their CRP for inflammation. I look at what can we do to make them healthy now so they're healthy in 10 years and 20 years, and they don't end up the statistic of being 50% chance of being diabetic by age 40. I don't want them to be there. I want them at 20 to realize that if we do stuff now to fix that insulin resistance and inflammation and gut health, that ultimately they're not going to end up being that statistic at age 40. So I really look at those from a metabolic standpoint and then offer them
That is
treatment
so
options. Really
good.
depends on what someone wants. Some of my patients are on birth control pills and they work on their nutrition. Some of them don't want to be on birth control pills and want to be on herbs. So we do herbs. Some people want supplements and nutrition. Some people just want nothing and they want to work on mind body medicine. So it's kind of just depends on it's personalized as to what are your goals. Let's look at where you are from a metabolic standpoint and what do you want to do? Where do you want to be?
So it's really a whole package. I mean, you're really kind of taking it piece by piece and seeing what is really bothersome and kind of going after that. which is so great, because I think one of the complaints that a lot of people have is like, oh, I have PCOS, I went to my doctor, it's birth control, but like really, like the periods don't even bother me as much. It's like some of the other stuff. And I'm studying for the national menopause exam that I'm going to take next month. And one of the things that, they were saying is, everyone should really be screened for cholesterol by the age of 21. Yep. And I can tell you that that is definitely not happening. I mean, even diabetes, sometimes I see women in their 30s and 40s and, they come in like recurrent yeast or something like that. And I'm thinking, hey, have you been screened for diabetes? And they're like, no. And so for everyone listening, that is a key point that, by age 21, really you should be screened for cholesterol. And sometimes it's some of these things that can tip you off towards this diagnosis. But the good thing is the earlier you diagnose it, the more you can do about it for your long-term health. So we touched on some of the treatment options. We touched on, so you mentioned like herbs and some supplements. So can you tell us a little bit more about that? Because I think a lot of people listening.
Yeah, so there's, again, there are a lot of tools you can use. So like if we were just talking about insulin resistance, we can use standard pharmaceutical options like metformin, right? That's used a lot with PCOS patients, but there are side effects. People have terrible diarrhea, GI symptoms. Some people get bottomed out from the metformin because it really is an FDA-approved drug for diabetes. We use it for pre-diabetics and PCOS, but truly it is a diabetic drug.
Yes.
And so I often will, people who are like, well, I just don't feel great on it. I don't really feel comfortable being on this drug for my lifetime. So I'll talk to them about inositol. Inositol is a naturally occurring compound in our body. Our body makes inositol, but we don't often get it necessarily in the quantities that we need. And so inositol can be a great option for lowering insulin resistance, and really no side effects to it. Like you just put a powder in your drink with your water for the day, and it works really great. Yeah. Cinnamon is a great natural compound for lowering insulin resistance. I mean, that's something that we can learn from Eastern cultures. They use a lot of wonderful spices that are actually really good for your gut that we just don't use in where we live. Yes. Things like berberine. Berberine is a great supplement. Berberine's great for people who have cholesterol issues. It's very good for lowering cholesterol, the metabolic profile, and blood and insulin resistance. So there are other options that you can use, and berberine's made from an Oregon grape tree. So it's like, these are all plant-based options. So it's rare that people have side effects to these medications. Some people do, but there are some other options besides just sort of saying, here's metformin, that's what you can be on. So we kind of use those supplements. I always feel food is the first option, but if you can't eat that food because A, you don't like it, or you just are not going to do it, then supplements are another option. Or you have gut issues. Some people don't tolerate garlic and all those other things, so they're like, I'd rather take these things in a supplement form. So I use sort of all of those at my disposal to help patients figure out what works for them, what's personalized for them, and what can you get from food and what do you need to supplement.
Yeah. That's great. Now, I would love to hear your thought on PCOS and obesity. So we know that PCOS can lead to obesity. We know that obesity can lead to irregular periods. But I've seen a lot of thin, seemingly very fit patients also have PCOS. So a lot of patients think like, well, I'm like, totally normal BMI. There's no way I'm having PCOS. But can you talk a little bit about...
so they call it lean PCOS, right? People who don't have weight issues but still are diagnosed. That's me. Like that was me 13 years ago when I was diagnosed. I was not able to have a child for over like 18 months. And essentially my doctor, who literally worked in my office, was like, no way you have PCOS because you're skinny. I'm like, well, something's wrong. I mean... I know how babies are created. It's not working. Yeah. So, like this, and so they often are misdiagnosed or underdiagnosed because people assume that, yes, majority of, less than 20% are actually lean PCOS patients. Majority are in the other categories of PCOS, but that doesn't mean that they don't have that. And that goes right back to that same idea. This is a metabolic problem, not a GYN specific issue, because those people with lean PCOS actually tend to have a lot of inflammation issues. They tend to have a lot more inflammatory components to their PCOS as opposed to insulin resistance issues. And so they tend to actually kind of get pushed off a little bit because they're not the ones struggling with weight. From an obesity standpoint and a weight loss issue, you know, my philosophy is, a lot of people ask me, that's one of the number one thing that how can you help me lose weight? And my answer is always the same. We're not going to focus on weight loss. When we focus on getting you healthier, you will lose weight. That is a symptom, right? Like it will happen when you start figuring out what is causing this imbalance to begin with and causing this sort of dysfunction. It's going to happen because if insulin resistance is a big component of why you have PCOS symptoms, when you start fixing that and reversing that, you naturally will start to lose weight, and those things will help. So I try not to focus on like, you know, losing weight as sort of let's lose weight, let's lose weight, let's lose weight, because I think sometimes it also puts people into that sort of, you know, every woman has been on a diet that didn't work, right? Every woman has been, oh yeah, my friend said keto is the best thing since peanut butter jelly, and so it's going to work for me, and then it doesn't, and then you're just completely shocked because you thought, what's wrong with me? Why did my friend succeed and I don't? So I feel like going from that standpoint of saying like weight, it really just is hard psychologically to do that. If you look at it as how can I then reverse my PCOS or heal my PCOS, it'll naturally happen. Those things will happen.
Yeah, that's a really good point. And, you know, I was talking, I'm curious about your thoughts on this. I'm South Asian, and I was talking to one of my friends who is a radiologist in India, and, you know, very bright guy who scans a lot of women. And he was just telling me that, you know, the amount of PCOS he is seeing is like overwhelming these days. And I know there is a link between South Asian women and metabolic syndrome, South Asian women and, you know, increased cardiovascular risk. I'm curious to see if you have any comments about that, and, you know, what extra things do you look for in women of South Asian descent, and especially regarding PCOS and metabolic syndrome and things that they need to be doing, you know.
Yeah, so the metabolic link, you know, we know that because of this metabolic dysfunction that women with PCOS as they age have higher diabetes rates, higher heart disease issues, higher hypertension, high cholesterol, the whole sort of gamut of what happens when you have metabolic syndrome, and then it's unchecked and it becomes these chronic health problems, chronic health disease. So anything from a vascular standpoint, your blood vessels, like you can imagine, is going to be a higher risk for women as they age. So, you know, from that link, that's why I think I'm so passionate about trying to help people understand in their 20s that, like, it's not a matter of, you know, get on the birth control pill. You're done having your children, be on the birth control pill till you're 40, and then you want to be off of it at 40, and then things start going awry. It's like, no. Even if you need to be on the birth control pill for contraception for the next 10 years after you're done having your children, we can still focus on making sure that we're checking your insulin resistance labs, making sure we're checking your inflammatory markers, make sure we're checking your cholesterol, make sure we're actually looking at you so that you become a metabolically resilient person, right, at 40 and 50 and 60, as opposed to playing catch up when you get to 50. You know, that's kind of what happens. I think that's where we're seeing, where you're talking about, we're seeing higher rates of issues of PCOS, because ultimately what we see across the world really is we're having a lot more insulin resistance, diabetes, that whole metabolic problem to begin with, right? And then it depends on, you know, I'm no expert on sort of different cultures by any means, but I would imagine that resources, you know, how you're being raised, access to good food, access to organic, access to decreasing toxins in your environment, like that all plays into effect. What happens if your parents don't pay attention to those things when you're a child and you're raised a certain way, you're unlikely to think about it when you're older. And if you still don't have those resources, that makes it difficult to do that, you know? So vicious cycle, and I try not to focus, you know, I really try to meet patients where they are when I'm talking to them about organic and toxins, and, you know, because this can get out of control and expensive too for people. So let's try to figure out what we can do in your environment and your circumstances to then do that. I think from your second question about sort of Asian women, I think, you know, I think the information is so, you know, now with Instagram and now with all this stuff, it's hard sometimes for people to get information that's science-backed. And I feel that some of that hinders the ability for some cultures who tend to be more quiet about talking about health issues. It's harder if you're inundated with information that may not be science-backed, if that makes sense. So I think that some of that can play into those obstacles as well, because if you are in a culture that tends not to be open about talking about health issues, especially female health issues, and someone's just on whatever social media platform you're on telling you that, like, I don't know, try this jade egg and you're going to become, like, get rid of your PCOS. I'm not trying to pick on Goop, but you know what I mean. Like, then maybe it might be difficult for you to understand, is this really legit or not? Totally. And I think it's great that doctors like you and me who are starting to get over ourselves and get on Instagram and get out there into the public to give science-backed information, because it's so critical. I know it's hard for me. I don't know how you feel about it, but definitely for me, I'm like, this is nerve-wracking to sit here on an Instagram. But I know that, like, I'd rather patients have legitimate information than think that the jade egg is going to fix their PCOS.
Yep. That's, 100%. No, that is so true. And yeah, I mean, I love how you're still, just emphasizing how this is a cardiovascular issue as well, metabolic and cardiovascular, and not just periods. For those of us who are joining us in between, just, we're talking about PCOS and how it's not just a GYN issue. It's really a whole body issue, and it's best to tackle it really in your 20s. And so, having said that, for the average woman who, maybe is having regular periods, everything's going well, no suspicion of PCOS, no one's really said, hey, you need to get checked for PCOS. In general, for the average 20, 25-year-old, 30-year-old, what kinds of screenings do you think are important when it comes to this, kind of this metabolic area? We do the pap smears, we do the mammograms when you're 40, but I feel like when it comes to the diabetes screen and the cholesterol, I personally think that it's a little too late what we're doing. A lot of these women are like well into their 40s before they get a hemoglobin A1C or cholesterol. I just saw somebody with a hemoglobin A1C of 12.1 the other day, and I'm like, oh my goodness, this is your first test. So what do you recommend when it comes to sugar and, checking your glucose?
Yeah, this is where family history, I think, is also really critical, because, if you're if you're 25 and everybody in your family is diabetic, then this matters. This makes a big deal for you. This comes up a lot with thyroid. I see a lot of thyroid patients. I also have Hashimoto's thyroiditis, added to the PCOS wonder. And it happens where patients will come to me and they're like, yeah, every female in my family has a thyroid problem. I'm like, well, then we need to be more proactive about paying attention to your thyroid, because I actually just recently saw a study that showed that 17% of early thyroid Hashimoto's people could actually have it reversed and not end up with lifelong synthroid. And we don't think of that in conventional medicine. We're like, here's your synthroid, take it till you die. How's it going? Like that. And so, but we don't think about what can we actually do to save someone's thyroid? Like, how can we save their thyroid and not let it get destroyed for the next 10 years? But we don't do that. So I think we also need to think of that as on the metabolic side too. Like, what can we do to save their blood vessels, save their kidneys, save their brain? I mean, look at the data now that's pouring out about metabolic dysfunction in Alzheimer's. 2 times the rate of men. Alzheimer's, twice. And we're not living twice as long. So there's clearly some factors that have to do with being a female that are really important when we talk about cognitive decline. So metabolic health is a huge component of that. And so really looking at women in their 20s, 30s and saying, hey, you have a bunch of family members with diabetes. I think you need to look at insulin resistance. Let's catch it before you become with your hemoglobin A1C of 12. Because once you already have 12, the cat's out of the bag there, right? We're in the diabetes range. We need to sort of catch it when you're starting to have the uphill and know. So I really think based upon someone's family history, I'll suggest like a full thyroid panel, or I'll suggest, and even with PCOS, they have a 30% chance of having Hashimoto's as well. So I'll often screen them for thyroid too. But certainly looking at cholesterol in women in their 20s who have a metabolic pattern or family history of metabolic dysfunction, and I typically do fasting insulin and glucose ratio because I find that a little bit better than sort of hemoglobin A1C. But, if that's what they have and that's what LabCorp has and that's what they have available, then hemoglobin A1C it is. We're going to get some sort of information as to where you are on the spectrum of sort of glucose control.
That is so great. That's such good information. So, I mean, this is all about early detection, prevention, setting yourself up with, good screening and good lifestyle modifications early on in your 20s. I mean, I kind of cringe when I think about what I was eating in college. And, I'm an educated person, but like, those Pop-Tarts for breakfast weren't really helping me out, and now, of course, now with social media and just how we're living, we know a lot more about nutrition. And, I think about how I am, educating my kids about, nutrition, that things that like I didn't really learn growing up. But it's so important, I think, to set yourself up well in your 20s when you're really solidifying those eating habits and those exercise habits and, seeing a physician, periodically and not just kind of like waiting till the last minute and all of these good lifestyle habits and modifications that we need to be doing. So I think it's really, really great that you're focusing on that in your practice. And I think we all should be. And, our current health system doesn't set us up for that, but luckily we have doctors like yourself who are really devoted to really doing that, especially for patients, who are
And I
suffering
think
from PCOS. So
I think one thing that we don't tap into a
awesome.
lot that we could as primary care for 20-year-olds really is anxiety and depression. We often will go straight to sort of, here's an antidepressant, here is an anti-anxiety medicine, but really that's kind of a really untapped area to say, what's causing your anxiety and depression? Like anxiety and depression is brain inflammation. Why do you have brain inflammation? Like, what's the actual issue? Is it probably in your 20s? It probably is gut. It probably is the Pop-Tarts. But if you don't ask the questions, if your doctor never asks you anything about what you eat, you need a new doctor, because what you eat is just as important as the metformin that's put in your body or the antidepressant or whatever. So if they never ask you what you eat, I'd move on
100%.
personally.
Yeah. There's no amount of quick fixes later, down the line that you could do to overcome those poor nutritional choices. So that you've been, kind of doing since your 20s, but it's never too late. So I think it's, better late than never, right? So like, even if you're in your 40s, your 50s, and you're just coming to this now and you're like, oh my gosh, I need to turn my life around, it's still not too late. So where can patients find you? I know you said you were in California.
Missouri.
And you're licensed in Montana. And do you say Arizona? Oh, Missouri. Okay. Okay, awesome. And
so I'm on Instagram, WellWomanMD. It's WellWomanMD, and that's the same thing for my website, wellwomanmd.com. And I have a Pinterest. I have all the sort of social media handles, so it's all exactly the same. And I do see consults for out of state if it's for like lab interpretation. Some people want a Dutch test looking at their hormones, so I can do a Dutch test for interpretation. But as far as like medically seeing you as a patient, it has to be California, Missouri, and Montana. Thank you.
Okay. Awesome. Well, thank you so much. Any last minute,
I think if you feel like something's wrong, if you feel like something's going on and you don't feel like you're getting the answer that you need, like, go find somebody that you can talk to that works. I think, sometimes it's a matter of chemistry, about figuring out the person that you can understand what you're going through and can understand what you're feeling. I think because now medicine has sort of changed into this 5-minute appointment, it can be hard for patients to sort of get those answers. And if you feel like something's going on, then don't ignore it. Listen to your gut, as they say. And I think that's really important to sort of continue to find the answers. And you too. I mean, people are seeking you because you're a fibroid expert, and you spend the time with them to go through and discuss with them, what are the options for fibroids? What can I do for my fibroids? How can I, heal and find the one that works for me, the option that works for me. And I think that's really important to be able to find that connection. Thank you.
Yeah, that's an excellent point. Well, thank you so much for coming on and sharing all your wisdom about PCOS. Such an important topic. We see so much of it in general GYN, and I'm sure definitely in internal medicine and primary care doctors. So really, really useful information. For those watching, please tag a friend who you think would find this information useful as well. And I'll be uploading it to
Thank
my YouTube
you.
channel at the Fibroid Doc.
You
Thank you
too. You
so
have a
much,
good
Dr.
day.
Roelands. Have a beautiful Friday and a good weekend.